Alrighty, hi everyone. Welcome to Collegeville Connections, our series of online events presented by the Collegeville Institute in central Minnesota. Our goal for this series is to highlight the good work being done by Collegeville Institute alumni and friends. My name is Jessie Bazan. I'm the program associate for the Collegeville Institute seminars, and I'll be serving as our moderator for today. Before we dive into the content, just a few quick logistical notes. So we have people viewing this webinar on two different platforms, Zoom and Facebook Live. If you have a specific question for one of our panelists, please put that in the Q&A box, and we'll have time, definitely save time for questions at the end. And if you're participating on Facebook, feel free to write your comments or questions in the comments box, and one of our staff members will be sure that that gets to me. And then finally, a recording of today's presentation will be available on the Collegeville Institute YouTube page later this afternoon. So feel free to rewatch or share. This is an important conversation that we're really honored to host on rural ministry and mental health. So in preparing for our gathering today, I came across an article published in the Journal of Clinical and Translational Sciences in 2020. That's called A Call to Action to Address Rural Mental Health Disparities. And its authors lay out some stark realities. Approximately 1/5 of the US population live in rural areas, and about 1/5 of those people, around 6.5 million, have a mental illness. And these statistics were reported right before the COVID pandemic, so we can assume that numbers are much higher now. The article argued that rural residents in the United States experience significant mental health disparities, even though the prevalence of mental illness in rural and urban areas are quite similar. And finally, a third point that I just found fascinating, adults residing in rural locations receive mental health treatment less frequently, and often with providers with less specialized training compared to adults in urban areas. So these are some challenging realities facing our rural communities. And here at the Collegeville Institute, the health and well-being of rural communities deeply matters to us. One of my monk friends is fond of saying that we're located on 3,000 of the most beautiful acres around. And we're really grateful for our location in rural Minnesota. We started the Rural Fellows Program in 2017 as one way to invest in pastoral leaders in rural congregations across the state. And I'm excited you'll hear more from one of our Rural Fellows, Heather, shortly. And thinking even bigger picture, the Collegeville Institute is a place that bridges religious differences. And as we prepared for today's panel, my colleague Stina made a great point about how rural and urban communities often do have real divides or differences, and disparities in mental health care can be one of those. So without further ado, I'm so pleased to introduce you to our three wonderful panelists, Brittney, Kim, and Heather. So just by way of introduction, I'd love for each of you to share who you are, where you are, and a little bit about the calling that brought you into rural ministry or rural healthcare. So why don't we start with Kim?
Thanks, Jessie. Hello. So my name is Kim Knowle-Zeller. I primarily right now, my callings are as an ELCA pastor, and then I'm a spouse to an ELCA pastor, a mother of two, and then also a writer. I'm on leave from call to be home with my kids and to write. And literally what brought me to Missouri, to a town of 1,000, was originally a call to a church 20 miles from here. And I've often said about call in my life that God has called me to places I didn't even know existed. And so that being right now Cole Camp, Missouri, which has been our home for about almost 9 years. My husband is the pastor in this town, and we live across the street from the church.
Wonderful. Thanks, Kim. And I see Stephen has joined us on the webinar. So hi, Stephen, too. I'm glad you're here. How about Heather?
Like Kim, I also am an ELCA pastor, married to an ELCA pastor. Our journey into rural ministry started on our internship, where we served an 8-point rural Minnesota internship site together. And since then, I've served in central Pennsylvania, in the Allegheny Mountains, several places in Minnesota. Our last call was in the Kenyon and Wanamingo area, 30 miles about from Rochester, which gives a unique healthcare perspective. And in December, end of December, we moved to St. Peter, and I'm serving on Synod staff in the Southwestern Minnesota Synod. So have care for the rostered leaders and congregations of a predominantly rural synod. So I'm also a spouse and then a mom to 2, and just settling into a new community. So learning lots about new resources and the gift of hospitality to those who move in among us in our communities.
Multiple callings that you're both juggling, and surely Brittney is too. Brittney, why don't you introduce yourself?
Yeah, hello everyone. My name is Brittney. I'm a third-year medical student pursuing my MD at the University of Missouri. Right now I'm in Sedalia, Missouri, completing clinical rotations on a rural track, taking a break from the OBGYN clinic to be here. And my call to rural healthcare, and especially rural mental health care, I grew up in a small town, and I always knew that I wanted to go back and eventually serve those types of communities. But both just, my experience as a human navigating this world and also my experiences in medicine have just always shown me that mental health is just as important as physical health, and that there are huge disparities in healthcare, but especially mental health care in rural areas. And so I hope to play a small part in bridging those gaps someday.
Thanks, Brittney, and thanks especially for taking time out of your busy rotations today to be with us. So next, I'd be grateful if you 3 would introduce us to the communities that you serve. What are 1 or 2 characteristics of the communities where you serve? And we'll start there. Let's start with Heather.
As I think about my former communities that I knew much more closely, these are folks who are well educated and are connected, but are also tenacious and strong and independent and proud of their history in their community. In the current setting I'm in the Synod office, that is a much wider community, but again, that same sense of rural tenacity, rural independence is really strong in almost all of those communities.
And Kim and Brittney, how does that compare with the communities where you serve?
We can relate to that word of proud and tenacious. So Cole Camp is a town of 1,000, and the church that we're a part of, St. Paul's, is one of 7 churches within just the town. Then there are rural churches outside of the city limits. And in a lot of the churches in St. Paul's, you will have 3 or 4 generations sitting together in the pews, worshiping week after week. Church tradition is deeply important. There are strong German roots, and the primary employment is agriculture or healthcare or education.
And Brittney, anything to add to that? You're in similar.
Yeah, I agree with all of the above. I do speak as a little bit of an outsider because, I'm kind of a transplant here doing my clinical rotations, but from everything I've seen, everyone in this area is very kind. It's a very tight-knit community, and yeah, tenacious is a great word. Everyone is very hardworking, very tough, very proud of who they are, where they come from.
Those are some excellent descriptors. And I'm curious then, what are a couple of stressors in particular that are facing families or people who live alone, maybe stressors related to work or retirement? You've got folks from spanning across the generations who are fierce, independent, tenacious. What are the stressors that are facing them these days? Brittney, would you kick us off with this one?
Sure. So, I would definitely say, as Kim mentioned, it's a very agricultural community, a lot of farmers, farmhands. And so, those types of careers come with their own set of stressors. The weather affects everything. Prices of crops and equipment, especially during the pandemic, prices of everything have gone up, and that's definitely hit farmers very hard. And then too, I've seen how hard the pandemic has hit this community, and it's been really tough. A lot of people have lost friends or family members. The hospitals have been overflowed with patients and not enough staff. And I know that's been a problem everywhere, but I think in rural communities, it's especially been a very prevalent problem. And so, I think the pandemic has been a huge stress recently, for sure.
Yeah, big stress across, but I appreciate those particular ways that the rural community is impacted where you are. Kim, what might you add to that?
Right, and a part of just some very concrete examples of where people are feeling the challenges. There are, in our town of 1,000, we are lacking daycare facilities. And so if you have working parents, or when school's in or out of session due to weather, or all kinds of reasons, we just don't have those resources right now. And so that then it trickles down and affects the larger community. And just like everywhere too, that with the pandemic, there's the stressors of the political world and the economy. And then sometimes the inability to see eye to eye and to listen, just the divide keeps getting wider and wider.
Yeah, bridging those differences becoming more difficult. And Heather, what about you, as you think both as in your pastoral role, then your larger role in the synod?
So one of the things I see is distance, both physical and interpersonal distance for folks has grown. Families are, even in our small communities, families are not always right there. And so for our folks living alone, or for our families who, when school's called off due to the pandemic or to winter weather, those kinds of things, physical distance, even physical distance driving to employment, physical distance to get to a hospital when you need it, becomes a stressor. The divide in our communities of not knowing where it's safe to maybe talk about certain topics, whether that's your feelings about the pandemic or whether that's your feelings about something school board did, the divide is really settling in. One of the stressors that we are noticing in our communities is we've had a lot of racism pieces coming up around high school sports and being acted out in high school sports, acted out in our community schools, and how that impacts those students, but also how it impacts the greater communities. And so that has been a stressor for students, teachers, greater community that we're working to find solutions for.
I'm curious, Heather, are those stressors relatively new in the last couple of years, or have you seen these issues of division and distance at play throughout your ministry time?
I have seen them get worse, I would say, in the last 5 years. And in the communities we just came from serving, but also now, the ability to be more public in one's reactivity, or in sometimes things that I would describe as racism or hate towards another person, the ability to feel you can be more open in that reactivity has really grown. To see a Nazi sign drawn at the community pool, to have a high school basketball game where athletes hear monkey noises because they're of another race, those things have increased in our community in the last few years.
Thanks for sharing that. It's no wonder then that mental health issues are even more so on the rise. If we focus particularly on the state of mental health in your communities, what are the particular mental health issues that are facing the places that you serve? And you mentioned a bit about COVID and the weather, and curious how farmers and other workers are doing in the face of pandemic, climate crisis, all these stressors that you just named in rural life. Kim, would you give your thoughts?
I think it goes back to there's just also a further divide in not talking then about climate change or the pandemic, but feeling a lot of anger and then which is affected by our mental health. And it was pointed out to us too that the uncertainty that the pandemic brought for most of the world is the uncertainty that farmers and people in the agricultural world feel day to day, and they do not get away from it. And then it just kind of keeps getting compounded and compounded. And just in outside of agriculture, we've had families who've said to us just in casual conversation, I miss the early days of the pandemic. Aside from the stress of what it was and the fear and the anxiety, families in particular, are missing slowing down and being with their families and being present and not going from here to there, because especially in a small town where there's so many ways to get involved and you can be involved, families are doing that. And it's great, but it also comes at a cost. And so people are just feeling burnt out already. And we're not even fully out of a pandemic, but we're tired.
Yeah, that burnout is so real. How does that, Brittney, compare with what you're seeing in the more healthcare setting?
Yeah, I agree with everything that Kim said. It seemed like even before the pandemic, maybe, just the stress of everyday life was just ramping up and up and up. And as we've mentioned several times already, certain communities, like agricultural communities, they will always be facing different stressors, constant stressors. And so in healthcare, I've definitely seen a lot of anger, especially, as a healthcare provider trying to talk about COVID safety, wearing masks, vaccines, all that sort of stuff. That tends to bring out a lot of anger and division. Yeah, a lot of people are they're tired, they're done, they're tired of the fight, they're tired of life not being how it used to be. They're tired of how expensive everything's gotten, how divided everything feels. And healthcare workers are feeling that strain too. It goes both ways. Healthcare workers are stretched very thin. It's very hard for them to watch all of the pain and suffering that's been going on during this time, both from the mental health side and the physical health side. I feel like we're definitely seeing higher rates of depression, lots and lots and lots of people on antidepressants now, which makes me a little bit happy to see that people are, reaching out for help and being willing to, take those avenues to take care of their mental health, but at the same time just goes to show how prevalent mental health issues like that are becoming.
Thanks, Brittney. And I'm curious if you'd be willing to share, and I'm struck all that anger that you're receiving, and as a healthcare professional, the burnout. We're seeing this all across the country, right, in healthcare. And I'm just curious how you have sustained your calling to ministry as someone who's relatively new, still a student, a medical student. How have you sustained your call in the face of this anger and burnout?
It can be difficult some days, especially whenever you all you want to do is help people, and sometimes it feels like people aren't appreciative, or people are directly going against the advice and all of the research that to be true, because you've been training to treat things like this your whole life. But I think I just have to remember that at the end of the day, we are still helping people. We've lost a lot of lives during COVID, but we've also saved a lot of lives. We've had some really sick people get better. We've given out a lot of vaccines that have prevented people from getting very sick, which has been amazing. So, and sometimes, if you just keep asking people, they'll eventually change their mind and decide that they maybe want to get the shot. So just, I think for me, forming relationships with my patients, just really getting to know them on a personal level, building that trust, and just having that personal connection really gets me through the day. And every little bit of good that we do tends to outweigh any of the negative stuff that we see.
Thank you. Your resiliency and that of your colleagues is just so admirable and greatly appreciated and needed. Thank you. Heather, how about you? Tell us about the state of mental health in your community.
I think for us, mental health is something, at least the community we lived in prior, and now I'm serving in a bigger role. Mental health is something that is on the radar and people are trying to reach out, but the resources are so slim. Even when we were by Mayo, the wait for pediatric mental health was 6 months to a year to get into providers. And we were within 30 minutes of Mayo. Or a young person who might have gone into the emergency room for a crisis with self-harm. Sometimes folks from central Minnesota were finding themselves needing to go 4 or 5 hours for the nearest mental health bed for peds or teens. And I know that was true in geriatric psych as well. So one of the struggles with mental health is finding those resources. Or our local school district had an in-school therapist, and it was somebody paid as a counselor outside the district, but they housed in the school. So parents didn't need to bring their kids out of school to take them far away to a therapist. For 2 years now, that has been unfilled because of lack of mental health care providers. And so one of the struggles is that accessibility, which telehealth has helped a bit with, but again, it's the struggle of accessibility, finding someone who's open. And I hear you, Brittney, on that exhaustion piece. We hear it from folks all over, just tired of the struggles, tired of today is one thing, but tomorrow is something new. And I think that affects our mental health as leaders, right? As medical providers, as teachers in communities, even our clergy, we're hearing that sense of exhaustion and what comes next. And so looking at how to care for those folks in our communities so they can keep caring.
Along those lines, Heather and Kim, I'm wondering if you might speak to any spiritual practices that you have offered people or would offer folks to combat that tiredness or that burnout. A couple weeks ago, we had Jonathan Malesic on to talk about his new book, The End of Burnout, and not just focused in a rural setting, but overall. And it's such a prevalent issue. Are there spiritual practices that can speak to that?
I think one of the pieces is letting people share that they feel exhausted, right? And finding community. I think some of our helpers, whether first responders, medical care teachers, clergy, have felt exhausted, but have felt they can't say it. So helping them find communities where they can be supported in that and say it and not feel alone. And this is not necessarily a spiritual practice, but maybe it should be, is helping people have permission to say no when they can't just take on another thing, and learning how to say a no that is gracious and frees people to find the rest or break they need.
Oh, yes, I love that. And being able to ask the question, how are you? And to listen, really listening, and then to understand that we can all hold both. We can have the anger, the sadness, and then to just offer that to God and to know that the church is a place that we want it all brought. We want to hear about what's churning in people's souls and what's going on, and remind people that this is what a community does. We hold it together with one another, the both and know that it's okay to feel the anger, the sadness, the joy.
Absolutely. It's making me wonder, as you're talking about, creating space to listen, how willing are folks in your community to talk about mental health issues? Is it talked about or not talked about? And why might that be? Brittney, do you have any initial thoughts on that?
Sure. I think in some ways I have been surprised at how much folks are willing to talk about it. It does take some level of trust and usually forming a relationship with the patient before they're willing to open up to, a stranger like me coming in from the outside. But I think, there is some stigma around it still, especially in these communities. But I think people do want to talk about it. It's just finding the courage to do so. And so, sometimes it might take a little bit of mustering, but I think part of that is trying to screen everybody. I try to make sure that I ask every patient how their mood has been, how they've been. And if they are a little hesitant or give kind of a so-so answer, I try to explore that further, and just let them know that they have somebody here who's listening. Because for some people, their doctor may be the only person who's asking those questions. And while, a family physician is definitely not just a mental health professional, they're not specifically trained to do that. They do have some training in that. And, they're there to listen and to help.
It sounds like it's especially important that you have that on your mind as well, in addition to all the other things that as a medical provider, you're having to ask and check for, having mental health up there.
Yeah, it's definitely been an increasingly prevalent part of primary care is mental health care. I know one time I was working with an older physician, also primary care, and he made the comment to me that while he's very empathetic and cares about people's mental health very much, he said, I wasn't trained to be a psychiatrist. I don't feel equipped to handle this. And I think that's changed some. In my training, we definitely focus on mental health a lot more than it used to be, unless you went into psychiatry or something like that specifically. But yeah, because there is such a disparity in access to mental health care specifically, we have to be equipped to be able to at least do some basic mental health care.
Sure. Yep, that makes total sense.
And I wonder too if people feel more comfortable with somebody they don't know, because I wonder if a part of it in a rural community is everybody knows everybody and has watched them grow up. And so there's just sort of, this is who that is, and this is what they do and how they act, and this is their family. So I wonder if there's just a little bit more security sometimes than in somebody who is not from around here.
Yeah.
But what was really, sorry, Brittney.
Oh, no, I was just saying that's a very good point. Because I think that is part of the stigma, is not wanting, the rest of the world to know your shame. And so in a small town where everyone knows everyone and knows everybody's business, that can definitely be a concern.
And I think sometimes there's the hidden mental health pieces that go underground that we don't see because of the vulnerability. And then there's some of the mental health pieces that are so public, right, in our communities. The suicides, when they happen, involve grief for almost everybody in the community. The addiction pieces that you see. And so you've got one side of the real public, vulnerable mental health pieces that are often bigger. And then you have the hidden mental health pieces that folks don't want to share because they're already so vulnerable. And I think a struggle in our small places is things like AA groups or recovery groups, or even coming to talk to the pastor. Everyone knows each other's cars, right? And so, wait, so-and-so's car was outside of the AA meeting. We knew people who would drive a half hour to go to an AA meeting or other support group, just so their car wasn't seen outside of that.
Thanks, Heather. That really does speak to the stigmas that continue to surround mental health. Kim, what were you thinking? You're a writer. You think a lot about language, and how are you hearing mental health talked about or not talked about in Cole Camp?
Mostly one-on-one. There's not a lot of larger conversations. So it's, again, asking people how are they, being able to listen, provide the presence.
Keeps the pastoral ministers and the healthcare professionals nice and busy, right? Mm-hmm. That's a lot, if you're thinking about the one-on-one visits and times to explore some of these topics, that's very intense. So I want to turn now to reflect on the church's response to mental health needs. And before I pose my question, just a reminder to those that are here and watching, feel free, if you have questions for Kim, Brittney, or Heather, feel free to put those in the Q&A or in the comment section on Facebook. So thinking about the church's response to mental health needs, I'd love to start off, Kim and Brittney, if we could hear a bit more about the innovative mental health ministry and partnership that St. Paul's Lutheran Church undertook as part of the Communities of Calling initiative, and I'll just explain for those listening, the Communities of Calling initiative is a 5-year grant program in which the Collegeville Institute is working with 13 congregations from around the country and one in Canada on questions of meaning, purpose, discernment. How do we talk about this in congregational settings and help people to really discern how they're called individually and communally? And we're lucky enough to have St. Paul's Lutheran Church as one of those 13 congregations. And we've been so excited about their partnership with the local medical students. So Kim and Brittney, why don't you share a bit more about that?
All right, I'll start. And then when we get to where Brittney came into the ministry, we'll let her take over. And I think we wouldn't necessarily, it's so interesting that we wouldn't even at the church call this a mental health ministry, but it's just what we've been doing. We've been listening. And I think that's sort of the key. The first thing we did when we received this grant is we were listening, like, what are we going to do with this money? How are we going to engage in calling? As we kept hearing over and over again about grief and dying. At that time, the congregation had a series of unexpected deaths. And so it was ripe on people's minds. And we listened and we went with where that energy was. And we created these series of conversations about grief, dying, and then the actual process of and planning for death. And we just went from there. And that then got us thinking, and we saw some articles too that even like what Jessie was bringing up about mental health and agriculture. And here we are in a rural farming community. And we just started again thinking, well, what can we do? We've talked about grief and death and dying, but how do we lift up the conversations that people are having in their grief and the sadness? And we just started asking questions and listening. And we knew that it would be very hard to get a group of farmers to come to the church and talk about their feelings, right? I mean, like that wasn't going to happen. We knew we had to just think different. And so as we're having this conversation, we had connected with the University of Missouri, their agriculture extension, and we got some resources from them because again, they were doing the work already. They had resources and we just reached out, started a conversation. And then somebody on our team heard about the Peterson Farm Brothers coming to our area. They are a farming family from Kansas. They're huge YouTube sensations, huge. And so we had the grant money. They were literally going to be in our area and we booked them. And we brought these farmers to our town and invited the entire town to come to this concert outside. It was last April. And we invited the extension, the Missouri Agriculture Extension, to come and have their resources about mental health, suicide prevention, and we had food. And it was interesting in that even the Peterson Farm Brothers commented as they were introducing and talking, because they lift up agriculture, they lift up stewardship for the land, and the kids brought their families. And they said, we have never been to an event that's been partnered with a church and the University Agriculture Extension. And we're like, oh, that's pretty cool. And the people at the extension office said that they noticed people coming over to the table when no one was there and taking some of the paperwork. So again, we just were of this mindset. We want to show our community that we care about farmers. We care about their mental health. We care about them. And so we threw a big concert. And then somehow this woman from the extension, her name's Amy, she was connected to the medical school, and somebody reached out to her and said, we have these 3 medical students who are coming to our area and they have to do a service project of sorts. Do you know anything? And this woman who we've been working said, we have this church that's been doing cool things, trying to connect with agriculture and mental health. Maybe that would be an option. And so that's how we sort of connected to Brittney and her 2 other colleagues.
Yeah, so I can pick up the story from there. Yeah, so as part of my school's Rural Scholars program that I participate in, we have to do this community integration project, which is basically any sort of service learning project that helps us target some problem that we recognize in the community. And me and my colleagues are we're all very passionate about mental health. And so I think that we knew that there was probably going to be a disparity in mental health in this area before we even arrived, just because that's how it is. And I mean, it really felt like a God thing to me, because whenever we got here and they said, wow, there's this, grant and this project that's already kind of in the works that would be great for you guys to just hop onto. It really spoke to me and just really felt amazing, great timing. Again, me and my colleagues are all very passionate about mental health. I'm especially passionate about mental health in rural areas and agricultural areas, because 8 years ago, next Saturday, my family lost my grandpa to suicide. And he was a farmer. He was a very caring, very strong, hardworking man, but he never talked about what was going on. Like, we still have no idea why he did it. We had no idea that he was even struggling at all. And so, it's very important to me to, help other people not go through that same thing, help people open up before it gets to that point. So whenever we found the Zellers in their Communities of Calling project, it just felt perfect. So we had to make a proposal. So we did some research on how can we target farmers and try to get them to open up about their mental health, because as we've discussed, not stereotypically not the population that wants to sit down and talk about their feelings. And so we kind of wanted to take the idea that they had already of their just having an event to kind of show appreciation, provide a lunch, that sort of thing. And we wanted to present it as a means of looking out for your community, looking out for your fellow man, not necessarily, oh, you need this for your mental health, but more of, here's what people in your community might be going through and how you can help them, which we thought, based on our research, would kind of serve a few purposes. It would help raise awareness and reduce stigma. It would make people in the community feel more equipped and prepared to be able to have these conversations, because I think that's part of it too, is not that people aren't willing to talk about it, but they feel scared. They don't know how. They feel like they might say the wrong thing or make things worse. Feel like they can't fix anything. So why should they be the one to talk to people about their problems? And so we wanted to provide a way to say, hey, your mental health is valid. Here's how you can talk to someone about what you're going through, or how you can get someone to talk about what they're going through. Warning signs to look out for, that sort of thing. So that, to help bridge the gap in healthcare, obviously, by training people in the community to recognize these things, it in no way replaces mental health professionals, of course, but at least there's people who, kind of know what to look out for and can, if someone's in crisis, help them get the care that they need, get them maybe more willing to try to seek out those more formal avenues of care, that sort of thing. So kind of a multifactorial approach to this process. And we're also going to provide other health screening services like blood pressure checks, blood glucose checks, to try to sell it as an all-around wellness event, not a mental health event specifically.
Absolutely.
Yeah.
Oh,
sorry, go ahead.
I was curious, has this event happened yet, or is it coming up?
It originally would have happened by now, and then we got a bunch of ice and 10 inches of snow and we had to push it back. So it's now occurring next week.
Awesome.
But there was a lot of community support the first time around. A lot of people were excited and planning on coming. A lot of people still did come, even in the snow. The caterer had already made all the food and the Zellers had rented the venue. And so they had said, anyone who's out and about, free food is here, and they still had a big turnout. So hoping that is a good sign for the actual event.
Kim, were you going to add something? No, yeah, that's the event sort of happened. It didn't happen, and it will happen again. But we punted and said, we called then as many people as we could who had to be out on the roads. Called the county road people, post office, the city workers, and we fed them. And again, just sort of this idea that showing up is so important, and how can we offer presence?
Mhm. That's been my big takeaway from what I've heard you all talk about, is in doing this ministry, the importance of listening to people, of how do you communicate or market what you're doing in such a way that won't, immediately turn people away, but will also, invite people in. And then to connect it to the community sounds really important, that this is not just an individual one-on-one thing, but there's a community of support and training and whatnot. So, we're so excited. I'll be eager to hear how the event goes next week, and just how innovative this partnership really is. Heather, how about you on your end, in your pastoral leadership role? Are there some ways that you and your colleagues are responding to the mental health needs in your community?
I think there's 3 ways. The first is often we function almost as first responders in triage. We get the calls that say, my teenager's in crisis, or my husband just died, can you come over? Or in the cases of suicide, often we are the first ones to get a call and respond, sometimes even as quickly as law enforcement in some of those small communities. And so I think a lot of our clergy play kind of a triage role, an emergency response, first call. The second is, I think we can be curators of resources, and with resources being so hard to find, knowing, like, our area has some mobile crisis response teams. And so knowing the phone numbers to those, so a family can call and we can hand that on. Knowing where those resources are, like the extension groups that in Minnesota also have rural farmer kind of mental health care. So curating some of those. We've tried to put on some educational events with NAMI, those kinds of things, just to point people towards a resource, knowing that we can't be the medical resource, we can't be the therapist, we can't do some of those things, and are sometimes destructive if we try. So pointing to resources. And the third thing for me is the power of community, right? People working together. And in our last setting, a group of clergy and community leaders came together for a group called KW Community Cares to talk about pieces like racism, mental health, bullying. We had food drives, we put together a mentoring program, but to do that wider listening of community leaders, and then to say, what could we help put in place? And I think those are the roles in mental health care, that triage, the finding and pointing to resources, and then community organization. And if we think about some of those crises in our small communities, whether it's a suicide for a student, the presence of our faith community immediately in schools or those pieces can do all 3 things. And it's a really important mental health resource, but again, just that presence that we're with you in this, and we're with our communities where the needs are.
Yeah, you're showing, Heather, how it's really a team effort in approaching this. And I really appreciate too bringing up the point on, what is the role of a faith community and what is not, what's left to medical professionals like Brittney and her colleagues. There's just all these different roles that community organizations can play. And it's helpful, I think, to hear where parishes could fall in that. Okay, I have one more question for you all, and then we'll take some audience questions. So I want to know, what's one piece of advice that you would give to a rural church that's looking to start some kind of mental health ministry? Kim, in your pastoral wisdom, what might you say?
I think it goes down to 2 things: to listen, to listen within your community, but then also the listening about who's already doing the work, and to feel that it's not up to the church to start something new, but to tap into what's already out there.
Great, thanks. Yeah, very in line with kind of what Heather was sharing. Heather, what piece of advice would you give?
I would say be present. And that means in the joyful times, right? We can rejoice over good harvests, we rejoice over graduations, weddings. Sometimes we get fearful and run away in the moments we're needed most because we don't know what to do as a church. We don't know how to help. And to just simply be present, whether that's with the family whose house has had a fire, whether that's at the house of a teenager who's struggling, whether that's at school, but be present and not run away from the mess, and bring God's presence to it as we can.
Presence and listening, and hearing those themes over and over. And that's so crucial in this type of ministry. And then Brittney, your advice as a medical professional for a congregation looking to get into mental health ministry.
Yeah, obviously I'm not in ministry, but faith is a very important part of a lot of people's lives, and in their mental and emotional and spiritual well-being. So I think, as everyone said, just listening, being present, and being non-judgmental, I think is really important. Even if you don't fully, understand or agree with what someone's feeling or what someone's saying, just trying to be empathetic and recognizing that is their experience and that they're struggling with it. I think that's very important, because a lot of people look to their faith for support during hard times. And I think, unfortunately, sometimes, faith communities may have stigma against mental health that then, pushes people away sometimes. And so I think just ensuring that you are that safe place for people to come is very important. And then again, feeling like you don't have to do it all, knowing what your local resources are, who you can refer to, it's also very important.
Absolutely. The world, we need more empathy these days, right? And turning to the people who are equipped to handle this, it's making me think I want to figure out who our local and mental health providers are. And I like that idea, Heather. I think you brought it up, of having the phone numbers available for different centers or crisis lines. So you never know when people are going to come to you and need that sort of information. Thank you. Well, this has been a great conversation. I would invite, again, anyone who may have some questions to put those in the Q&A of the chat. We have a question, Kim, for you. Someone's wondering, how has this Communities of Calling Initiative project affected your church's vision of who the church is called to be in the community?
That's a great question. Thank you. So part of I think, and Jessie, you can correct me, but a part of the hope of the whole initiative, which was that it was 5 years, is the reality that it takes a while to have calling ingrained into the lives of the congregation. And so we started out, as many of the congregations did, about just language. What is a calling? Who is called? How are we called as children of God? How do we see ourselves with multiple callings? And that's been one of the gifts then, to have the language and to keep it before us in worship. So with liturgies of blessing the various vocations in our congregation, on social media, lifting up the callings of people in our community. And so that the hope is, in the years to come, that the lens is there, that now this is how we view ourselves as a community that is called, first and foremost, as children of God, and then as a community that is called to one another in the church walls, but then more importantly, also we're called into the community as people with individual callings and vocations who can share and learn and grow and continue to do the work in the community that's needed. I don't know if that's, so I mean, really the hope is that this isn't just another thing that we do, right? That calling is ingrained into our congregation. And so we've been praying yearly, every group that meets prays the same prayer that lifts up vocation. And that's one example that we just keep ingraining it into the life of the community.
Yeah, Kim, you and Stephen and Melissa and your whole team have done such a wonderful job of laying that foundation, of doing the formation, the education around what do we mean when we're talking about being called? What does discernment look like? How do we listen to each other? And you did that over the first few years so that now you are able to host and promote some of these more difficult conversations, more difficult points of discernment. But there just seems to be a really good layer within the community of understanding, as you're saying, what this calling business is all about and what it might look like to be called together in that particular place in Cold Camp, Missouri. So.
Right. And I think so. My husband, Stephen, he said this very early on and preached about this and said that the clergy have sort of taken calling and sort of away from everybody else, that it's not like we're not the only ones who are called to ministry. That language is very critical in being called to ordained ministry, but that's not the only way to be called. And so we've opened it up for others to see their calls and their multiple callings.
Yeah. Yes. You're doing such great work on that front. Yeah. Thank you. Well, while we wait, maybe just another moment, if anyone has any last questions. I just want to know from the three of you if I missed anything, missed any questions or points that you want to be sure to raise in thinking about your own ministry or healthcare work with regards to mental health. Anything that still needs to be said. This could be an ongoing conversation for a long time. There's so many layers to this. Is there anything else that you'd like to add?
Well, I have a question for Brittney.
Please.
Because you touched on the burnout within the medical field, and we've seen that and heard it too. But so what's the hope? Like, where are you seeing the hope for the medical field and the people who are coming into, or for the people who have been in it for a long time now? Like, where are they finding energy and respite?
That's a good question. And, like we've talked about everyone is sharing this experience of they're not really, of the uncertainty of not knowing how much longer this is going to go on. And I think that makes it hard, especially for healthcare workers. But I think, I think part of the hope that people are finding is just, trying to not focus on the differences in the divide, but focus on the patient in front of you, regardless of how they feel about things and what they've done or not done in this pandemic. Just focusing on, this is my patient and I have to care for them. And I think that trauma bonding has definitely been a real thing. Everyone's sharing this experience and helping each other get through it, and I think that's very important. Again, being willing to talk about the things that we're going through together and share our experiences and lift each other up, I think has been very, very important.
Amen. So well said, Brittney. And we had another question about what gives you hope in your ministry as it relates to mental health. Heather and Kim, maybe if you can speak to the pastoral side, what gives you hope?
The fact that we're talking about it gives me hope. I mean, I think there was a time in the church that it wasn't talked about and it was very stigmatized. You think about our burial process for folks who might have had mental health issues and crises. We've come a long way as the church, so that we're talking about it gives me hope. And also, like Brittney, some of the real concrete moments, seeing somebody who has gone for help and is doing better and is finding a bright spot, some of those concrete moments, or having someone feel that they can finally come and say they're struggling in an environment, like those little concrete steps, and the fact that we finally have opened a door to be able to talk about it in a way that matters.
Yeah, I echo that, all of that. And that the resources are there, that there's so many different ways people can be connected online or on the phone now for resources. So I'm just grateful to have the conversation.
Mm-hmm. Absolutely. We'll do one more question here, and this one is geared towards Heather and Kim. Glenn is wondering, have any of you sponsored suicide alertness training in your communities? He says, sometimes it opens others to learn about common mental health challenges.
Not in my time history here.
We did not do specific suicide training, but we brought in NAMI to talk about ending the stigma of mental health. A hard part, I think, in some of our small communities is people think if you do an educational event and they come, it labels them as having that. And so it was low attended, but the NAMI pieces, I know a lot of our clergy are starting to do suicide training, which is also a positive piece, though it doesn't spread into the greater community in the same way.
Great, thanks for that suggestion, Glenn. And thanks to all three of you, Brittney, Kim, Heather, we so appreciate your time, your insights, your thoughtfulness, and the ministry and care that you're providing to your communities. This is, I'm sure, just a first conversation that we're having here at the Institute. Rural Fellows, I know, are meeting next in May, and we're just so grateful to be able to partner with you all and learn from your experiences. And thanks to all of you too for joining us on this Collegeville Connections. We would love to have you back here. Our next Collegeville Connections is on April 6th. Patrice Gopo, who's a wonderful author and writing teacher, is going to be offering a workshop and discussion about the importance of bringing concrete language and details into spiritual writing. So you can register for that on the Collegeville Institute events page of the website. And we hope to see you back here again soon. In the meantime, have a wonderful rest of your day and take care. Bye-bye.